Hello and welcome everyone to another episode of Scott Schilling Speaks. I'm your host, Scott Schilling. Looking forward to our conversation today because Darrell is the CEO of Orriant. He's a healthcare innovation specialist. He's part of Forbes Business Council as a member. And so there's a lot we're going to talk about here with healthcare. Darrell Moon, thank you for joining me here today on Scott Schilling Speaks.
My pleasure.
So we did a little pre-talk earlier, and you talked about the message that we need to start as the base message here today. So the floor is now yours.
Well, let me start by explaining what the word Orriant means. So it's a word that we made up. It's not a common word. People haven't heard of it before, but it's two Latin words or Latin suffixes put together. The word in Latin, orire, or ori, means to rise up. And the word riant in Latin means to be of good cheer, to enjoy life, to be happy. So we're all about helping populations to enjoy life more by experiencing better health, better well-being, and we do that by supporting each individual in their own journey towards being healthier.
That's awesome. So as we were talking a little bit earlier, you made the statement, we don't really have a healthcare system to a certain extent. We've got a sick care system. So how are you working as a healthcare innovator to give people some choices that they need to know about?
Can I answer that question with a question?
Sure.
So, do you know what the largest industry in America is?
I do not know that answer.
It is the healthcare industry.
Wow.
It is almost 20% of our entire gross domestic product, which means every $5 in your pocket, $1 goes to the healthcare system.
Wow.
Do you know what the third largest killer in America is? The cause of death?
No.
The healthcare system.
Wow.
Healthcare errors are, according to Johns Hopkins study, the third largest reason or cause of death in America. Now, when I asked my daughter, who's an ICU nurse, how she felt about the fact that healthcare system is huge. And by the way, let me also mention that when I was born in 1960, the healthcare industry represented 5% of our gross domestic product. No other industry has exploded over the last 60 years to going from 5% to almost 20%.
Wow.
That's 4 times as large. And largely, that's a system that's designed to fix people after they fall off a cliff. The system is not designed to improve health. The system is designed, once you fall off a cliff, we're going to make money fixing you. Now, I can say that because I used to run hospitals. I was at the top of the food chain. My goal had nothing to do with really aligning with my customer. It had everything to do with making money when people had a problem.
Got it.
So I asked my daughter, how do you feel about the fact that the healthcare system is the third largest cause of death in America? And I thought her answer was so appropriate. She thought about it for a minute and she said, Dad, I think people should try harder not to get sick in the first place.
You know, that seems like a little bit of common sense, but as they say, common sense not so common anymore, right?
Exactly. Well, what's amazing is that when you go across the world and you say, all right, what is the best healthcare system in the world? Is it the system in Germany? Is it the system in Singapore? Is it the system in Canada? Is it the system here? There actually is a healthcare system out there in the world that achieves much better success than any other system. You can put it on a pedestal. It's the best healthcare system in the world. It costs half as much as the American healthcare system, and it gets superior outcomes better than any system in the world. And interestingly enough, it's a system created by the native Alaskans 20 years ago in Alaska. They were given the opportunity to take over the healthcare system that was given to them or was provided to them by the Federal Indian Healthcare Services system. And they said, you know, our health scores are in the lowest 5% across every health score. We couldn't be worse. We're not a very healthy population. Mm-hmm. And the system that we're being given is pretty much an emergency room at a hospital.
Okay.
And we can't make it any worse than it already is. Let's do that. Let's take over healthcare and let's create our own healthcare system. And they did something that no other healthcare system in the world has ever done. They built a healthcare system based on asking their customers what they wanted from a healthcare system. And amazingly, instead of the traditional healthcare system, which is we're the medical institution of all the wisdom and knowledge, you come to us and we'll fix you when you fall off a cliff. They went to their 60,000 Native Alaskans and said, if we're going to build our own healthcare system, what do you want it to look like? And the Native Alaskans and the tribal leaders said, stop being paternalistic. Stop telling us what to do. Get on our journey with us and help us take ownership on our own health and walk with us throughout our lives, helping us maintain optimal health instead of just being there when we fall off a cliff. So they did something that nobody else has done. They actually built that kind of a system.
And I know that we had talked about it last week as we were setting up for the show and different things, that it is performing tremendously well.
Oh, and they peak in their entire population from that low 5% to now they're in the top 90% in many of the HEDIS scores. It's like, you show me anywhere, any healthcare system that has actually improved the health of their population. It hardly exists. I'm not aware of any system that can actually show that they've improved health. They will fix you after you get sick, but they're not designed to improve your health, which is what the NUCA system did, which is why they actually balanced the focus of the healthcare system on the needs of the customer.
I mean, it makes way too much sense.
It's so intuitive.
Especially as broken as the system is today. We were just discussing a family member of mine having to go to some emergency rooms and different things. In the bills, the numbers are astronomical, and it's somewhat after the fact and still not delivering an answer.
Well, can I give you a statistic that will literally blow your mind?
Sure.
I just learned this last week from our own Aspirational Healthcare Conference. One of the gentlemen that was from the NUCA system presenting shared with us that in 2018, just 3 years ago, probably hasn't changed much, we spent $3.6 trillion in healthcare. If you take all of the money that went to providers to provide the care, it only represented 27% of the total spent. The other 73% was all of that infrastructure waste, all of the money that goes to this healthcare system that's far more a financial institution than it is a healthcare system, improving health. And almost 75% of it is going into the infrastructure, not providing the actual care, but actually just, like, for example, every time you go to the doctor to just see a primary care physician, which they may spend 10, 15 minutes with you, there's like over 100, I think he said 140, maybe even 160 places where you have to check a box to make sure that the insurance company doesn't deny the payment. So if you're spending your 10 or 15 minutes having to check 140 places, your focus isn't on building a relationship with the patient or supporting them in improving health, right, or even patient care. It's doing whatever it takes to make sure you get paid for the service.
It's phenomenal. Again, the numbers, it just astounds me. I had an event a number of years ago, and it was 6 days in intensive care, and it was $278,000 later.
That's a lot of money.
And I don't know that I improved. I went in there alive and I came out alive, but that was about it. Well, and you sit there and go, how can a system operate at those kinds of levels?
Well, and I'll tell you exactly why. As a hospital administrator, like I said, I ran 10 different hospitals all over the country. I sat at the top of the food chain. And when I studied the principles of Edwards Deming, which is continuous quality improvement, and if you really boil down this whole Six Sigma lean management, Edwards Deming philosophies, it really is, you ask the question, who's the customer? And how am I delighting my customer? And how am I monitoring my processes that impact whether I delight my customer? And I use the people closest to the process to improve those. So as I'm applying these principles to this hospital, it became very apparent that when I step back and I apply those to the entire healthcare system, it's not the insurance companies that are the customer, and it's not the doctors, which is where most of my focus was, because they're the ones who could admit patients. You have to ask, well, who really pays for this largest industry in America, fastest growing industry in America? It's business leaders. It's largely the business leaders who are willing to spend the money to attract and retain employees, so they offer these health benefits to their employees. They're the buyers of the healthcare system. And I thought to myself, I could no longer be more perversely aligned with my customer than I am. I don't want them to get what they want.
Right.
What I want is to fill up my hospital. And all my work is about attracting doctors to admit to my hospital versus somebody else's. If I were to really look at my customer and say, what do you want? And now I speak to groups of business leaders across the country, and they always tell me they want to attract and retain top talent. They want a healthy, productive workforce because the product that goes out the door is directly tied to the health and productivity of their workforce. They want their employees satisfied with the healthcare system, and they don't want it to cost so much. I was no more aligned with giving them what they wanted. It's like, I didn't even have to worry about it. How is it? This is why I left the treatment side of healthcare many years ago. It's like, how is it that an industry can get away with making so much money and charging so much money and be so misaligned with the customer who pays for it? Well, it's because we have all of these levels and layers in between the customer and the providers, like the doctors, and everybody's misaligned to see the healthcare system grow. You might think, well, the insurance companies are out there doing their best job to keep the costs low. That's not true at all. Insurance companies, especially with the Affordable Care Act, where they only can make, their admin has to be 15% of the total cost, or they've got to give the money back. So if healthcare is going down, that 15% becomes a 15% of a smaller number. If it goes up, it's a bigger number because it's a 15% of a bigger number. So in the end, if you really look long-term, insurance companies, and they've seen incredible profits since the Affordable Care Act went into place, they're not aligned with the customer. They're not trying to keep the cost down. They actually benefit from this exploding healthcare system. And the consultants who represent them are often getting commissions that go up as healthcare costs go up. So the poor employer who's trying to run a business, the last thing they want to think about is healthcare. And they turn everything over to a system who's all misaligned to make more money as costs go up. And the poor insurance, the poor employer goes, my goodness, a 20% increase? Are you kidding me? Well, the broker who just made arrangements with the insurance company to say, hey, look, the insurance company says we need a 15% increase. Well, let's give them a 20% increase, and I'll go out and I'll share that 20% increase with the employer, and I'll come back and beat you up, and you'll take 5% off, and we'll come back and say, okay, they've come down to 15%. I look like the hero, you look like the hero, and the employer just had a 15% increase while their business is growing at 3%.
Yeah.
And we can't figure out, why is this system so broken?
Well, I think we got a pretty good idea why it's so broken. I think there's a whole lot more awareness. That's why we want to do shows like this that at least start the conversations and things like this. So what can we do about it?
Well, I think, the healthcare system is doing exactly what it's designed to do, which is make money and treat people. I'm not going to say it doesn't treat people, because it tries to, but it's not working to keep them healthy. It's working to treat them and make money when they fall off the cliff. So in my mind, the healthcare system is not going to transform itself. Why would it? Why should it? It's really about business leaders who are the ones spending the money, who are paying for healthcare, to simply recognize that, just like they do with every other part of their business, and they align those people in their company to bring them what they want, they just need to apply those simple principles to the way they buy healthcare. It's often the second largest cost of doing business. They don't like to put a lot of focus on it. It's not their most important thing. They turn over this responsibility for often the second largest cost of doing business to a benefits manager or HR director who wears lots of hats and, quite honestly, is not incented, like everybody else on the senior team is, with incentives. The
Right.
CFO gets bonuses to bring in profitability. The COO gets bonuses to bring in efficiency. Sales gets bonuses to drive the sales. But how often do you see, in fact, I have the privilege of getting in front of a lot of business leaders every year. I'm the most used speaker for the largest CEO organization, Vistage, in the world on this topic of controlling healthcare costs. And I ask business leaders, do you give your CFOs bonuses to bring you profitability? Sure. Yeah, they all give bonuses. How many of you do anything to recognize, to incent, to bonus the person you put in charge of the second largest cost of doing business to give you what you want, which is those four things: attract and retain top talent, improved health, employee satisfaction, lower costs? Guess how many CEOs say they do that?
Oh, it'd be zero.
Zero. Nobody does. It's like, this isn't a problem for the healthcare system to fix. This is a problem for business leaders to recognize they're the reason the system doesn't work, and they need to change that. They need to align their HR folks or their benefit managers to where when they get those four things they want, they get to make more money. And they'll in turn go to the benefit consultants and say, you too are going to make more money when I get what I want. I'm going to put you on a fee-based contract, and your incentives or part of those fees will be at risk. And the more I can attract and retain top talent, the more money you're going to make. And the better I can do at improving the health of my population, the more money you make. But until that alignment of incentives is created, the world of healthcare, the benefit consultants, the insurance companies, the providers, they're going to keep taking advantage of these customers as long as they allow it.
Yeah, for sure. It's fascinating because we do so much business with entrepreneurs and smaller business owners, and some of the things that they have to take or that they can't even they can't put into place. Their health benefits, they're fighting for their lives, just to stay afloat, especially in everything that's happened over the last year and a half or so. So what are some of are there incremental steps that they can take to becoming better?
Well, the good news is this: there are some entrepreneurial companies out there in the healthcare space that are recognizing this disconnect. And they're recognizing how important it is to build a healthcare system around the customer. Mm-hmm. And they're also recognizing how important that primary care is in the overall equation. I like to describe healthcare as a car going in the wrong direction with 4 blown out tires. And we spend all of our time focusing on tuning the engine.
Yeah.
I'm sorry. If you don't fill up the tires with new tires, it's not going to go very well. And those 4 tires are: primary care is badly broken. We don't do enough to help navigate people through the system.
Right.
The number one biggest reason for why people get sick in the first place is behaviors, and we do very little to support people in making complex behavior changes. Most of the wellness industry simply passes out incentives for people to do simple tasks, which by itself can't improve health, with the exception of a few people. And then we don't do mental health very well. Well, what these innovative companies have done is recognize that what Nuka did is they built a massively powerful primary care system that had a whole team of primary care providers, a doctor, a nurse, a case manager, people that are assigned only a few people, so only 1,000 people instead of 4,000 people. And their primary job was to influence those 1,000 people to live healthier. Creating diagnostic plans or treatment plans or ordering labs or ordering x-rays, that was secondary to influencing their population to live healthier. And they built their entire system around training these doctors and nurses and medical assistants and case managers on how to be coaches, how to influence people to live healthier. And every interaction, their motto is every interaction with a patient or a member, the most important part is, did they want to change after your interaction with them? If you haven't influenced them to try to change or want to change, you've missed it. You've missed it entirely. If all you're doing is fixing people when they fall off a cliff, there's no way we're going to improve population health. And so they took doctors who were trained to be diagnosticians in an academic medical training program and created coaches out of them. They trained them how to be motivational interviewing and empathetic listening and actually influence people. Well, you can't buy Nuka. I can't send those entrepreneurs in the country to buy healthcare from Nuka because it's only for those Native Alaskans in Alaska. But there are companies popping up across the country Redirect Health is a good example. They have built a great solution on the premise of primary care. They created a healthcare solution where primary care and putting more effort into an aligned primary care system, and it's a virtual primary care system, so they can do this anywhere across the country, is the focus. And there's pieces of that that are about helping them deal with those other flat tires. Well, because their focus is on prevention and aligning members with the doctor, go figure, they're half as expensive as the rest of the, I mean, most of the healthcare system is about $10,000 per employee or per member, and theirs is like $4,500. You know, so it's this huge disconnect between what traditional insurance does and what new innovative systems can do to bring a solution that's far more focused on keeping you healthy, which is going to cost a lot less, just like NUCA proved, than to simply be there when people fall off a cliff.
It makes so much sense. Again, just thinking about the conversation my wife and I had about this family member going, and it wasn't about diagnosing the issue. It was about eliminating possibilities. You know, they're running test after test after test and all these different things to go, well, no, it's not that, it's not that, it's not that, as opposed to it is this. It's amazing that when you get into a little common sense conversation about this, you realize how uncommon it really is. And yet it's also not sustainable.
No, we can't. How much bigger can healthcare become as a percentage of our gross domestic product? It's already getting close to 20. It used to be 5. Can it really take over and become 50% of our entire gross domestic product? Well, until business leaders rise up and go, this is not okay. Warren Buffett talks about healthcare as a, what's the word he uses analogy of a tapeworm. It's business's greatest tapeworm because it just keeps eating up a portion of business. Well, it's because business has not applied the very same principles towards this second largest cost of doing business like they have every other part of their business. They haven't aligned the system to work for them. And really, that's the solution. The system needs to be focusing on getting the customer what they want instead of simply making money when people fall off the cliff. And that's where its focus is.
It makes so much sense. So how do we get there? What do we do? Well, is it an educational process for business owners at all levels?
I think it is. And I think the most important message that any business leader can hear is stop putting all your eggs into one basket and start aligning the system to work for you. In other words, fix your relationship with your broker. Stop letting them make more money as your healthcare costs go up. Put them on a fee-based contract and align them and their incentives. So part of those fees are going to be bigger if they help you get the 4 things you want: attract and retain top talent, healthier population, employee satisfaction, and lower costs. Now you've got your benefit consultant working for you. Now build an aspirational healthcare benefit for your employees. You know, what NUCA built was an aspirational healthcare system where they put a tremendous amount of focus on a primary care system that not only was there and available immediately to take care of the problems, but their primary focus was on helping you live healthier. Well, direct primary care is a new model of healthcare for primary care across the country, and it's growing, which is great. And it's not about charging fee for service, it's about a subscription model. And what we suggest employers do is say, take the very same amount of money you're spending right now on a major medical plan and say, don't put all your eggs in one basket. Say, I'm going to spend so much money. I'm going to spend so much money on major medical, but I'm going to put all my money there. In fact, I highly recommend that employers look at options where they can have a much cheaper group program through Redirect, where they look at solutions like sharing programs, where you say, here, I'm going to give you some money. You choose what works best for you. If you want my group plan, choose my group plan. If you want a sharing program, take my sharing program. If you want to go buy a program on the exchange, buy that. And if you spend less than what I'm giving you, I'll give you the difference. And let market forces apply to major medical. Now take another part of that money and put it in a different basket called direct primary care, where And if they buy a plan like Redirect that already has it in, then they get both buckets. But if you're not willing to go get a direct primary care physician who's aligned with you to keep you healthy, that's fine. I'm not going to force you. If you want to stay in the current traditional model, that's great, but you don't get the money. If I'm going to give you $150 every month for a direct primary care physician, and you're not willing to go get a direct primary care physician and actually go see them at least once a year so you build a relationship with them, you don't get the money. It's as easy as that. Use your major medical when you need it. But if I'm going to allocate some money, I want you to be aligned with your doctor where they make more money by helping you stay healthy versus making more money as you get sick. And then you need an influencer. What NUCA did is they taught their primary care physicians how to be coaches. Well, most doctors are not trained to be coaches. They're trained to be, they're academics. They're right. About, which diagnostic, which diagnostic tool to use. How do you create a diagnosis? How do you create a treatment plan? And if the patient is not compliant, well, that's too bad. We'll call them non-compliant. That's their problem. No, NUCA proved that primary care's primary focus should be on influencing people to live healthier. Well, even though you might be a direct primary care physician, that doesn't mean you are trained to be a coach. Doesn't right. mean you understand empathetic listening. Doesn't mean you understand motivational interviewing. So put another bucket of money, 4 buckets. Put money into an influencer, whether that's a health coach or someone else that can work with your people to influence them at their own pace, at their own interest. Don't tell them what to do. Simply be a support to have them accomplish the things they want to do to improve health. And if they don't want to use a coach, don't give them the money. And I like the idea of, look, give the money to the person. That will bring them to the coach. Yeah. For those who choose not to, budget that money and let the people who choose not to work with the coach fund the program for those who do work with a coach. And then the last bucket is a savings account, like a health reimbursement account that can roll over every year. I like the idea of letting their employees invest in that so when they leave, they can keep those accounts open. And then bring in the consumerism so that if there are deductibles or copays through the major medical, the employee is, there's consumerism built in. So that's what we teach employers. You take ownership for building an aspirational healthcare benefit for your employees and actually give your employees choice. And that will drive the demand to where the healthcare system will go, oh, well, we need to start providing services for what the customer wants.
Yeah, there's definitely, we all need to be more involved in this as opposed to simply watching this thing continue to grow and explode and be more ridiculous, quite frankly. I from that side, man, hard to believe that we've run through our time already, but how do they get a hold of you to learn more and gain some of your expertise?
Sure. So a couple of things. Orriant.com is our website. That's ORRIANT.com. And you can contact us through that. And again, we provide services to improve health through coaching. But you can also go to aspirationalhealthcare.com. We just put on a conference last week. And for 8 months, we've been building this conference to have some of the best experts in the country, as well as the folks up in Alaska. The Native Alaskans helped us put on this conference where they could share their successes. So aspirationalhealthcare.com will really help business leaders understand, wow, I'm settling for something that I could be getting something much better, much less cost, much better outcome. And the best way to learn about that and to really figure out what are the options, go to aspirationalhealthcare.com.
And if you're in a Vistage group, obviously, you got the opportunity to
that's right,
to have Darrell come and speak to your group.
Which I enjoy doing. One of my favorite pastimes to do is to get in front of a group of CEOs and go, guys, this is your problem, or gals, this is your problem to fix, not the health system's not going to change anything. It works for them.
Exactly. So I've been part of those groups, and they are tremendously valuable, and so you can get that information there. Just want to say thank you for joining us here on Scott Schilling Speaks. Look forward to seeing you again tomorrow, exact same time. God bless.
Thanks, Scott.